Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, public higher education in this state, but first, the Acting Secretary of Health joins me, and we're going to talk a lot about health care. As they say, let's get to it.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, Keara Klinepeter is Acting Secretary of State here in Pennsylvania. We're going to talk about a number of important healthcare states. Secretary Klinepeter, welcome to the program.
Thanks for having me, Terry.
All right, well, I'll tell you something. Let's start with influenza. What's really fascinating is we did not hear a lot about the flu this year, and my sense is it's largely because vaccinations, masks, COVID-19 all dominated the discussion. So could we spend a couple of minutes talking about influenza activity in the state?
You bet. So this flu season, we've had just shy of 34,000 confirmed influenza cases across all 67 counties in the Commonwealth. What's been really fortunate, though, is that the death rate has been quite low, and we've only experienced 31 deaths. So I think compared to the COVID rates, numbers of hospitalizations and deaths, we didn't hear as much about flu, but I think that goes in part and parcel with the fact that we really emphasized people getting their flu vaccine this year. And I think that probably had a lot to do with the lower rates. Yeah,
well, obviously they're spread across the state of Pennsylvania. Obviously we're talking about the flu. And the larger the population in a county, presumably the more flu cases there were. But did any geographic regions in the state stand out?
They didn't, no. We saw a pretty consistent and even trend across the Commonwealth when you look at the rate per 100,000.
Yeah. And the current trends compared to previous seasons?
So it's a bit hard to compare. As compared to last year, which had a staggeringly record low number of influenza cases, we saw a bit of an uptick this year, but it was slightly more comparable. Compared, though, to prior flu seasons prior to 2020, this is still quite low. And again, I think that goes back to vaccinations and mask wearing.
Yeah. I mean, I didn't even realize there were subtypes of influenza. I figured there were types, but subtypes of the virus are currently circulating.
Correct. So it's mostly influenza type A and type B. But that's why, every year the flu shot and the combination of what's in the flu shot has to be different to contend with the latest strain that is circulating.
Yeah. But you say here in a report that it's estimated that 5 to 20%, 600,000 to 2,400,000 of Pennsylvanians get the flu each year, and 120 to 2,000 die from complications of influenza.
We were fortunate that this year it was significantly lower, again, because of vaccinations and mask wearing.
Yeah, well, so how about the flu shots? Are Pennsylvanians buying into that? And this year they might have had to get the COVID-19 vaccine and then turn around and get a flu shot, or vice versa.
Yeah, so we strongly encouraged folks, particularly earlier in the fall and winter, to get a flu vaccine at the same time that you got a COVID shot. That's what I did when I went and got my booster shot. I got that in one arm and I got my flu in the other arm. And I think a lot of Pennsylvanians opted for that.
Yeah, I got both, but I did not get them at the same time. I got the flu shot first, and I got the COVID-19 shot, but either way. Well, look, let's run to a break. When we come back, I want to talk about vaccine trends, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. Well, I'm talking with Dr. Klinepeter. She's Pennsylvania's acting Secretary of Health. All right, the vaccine trends, and there's been this big debate about getting the vaccine, as you know. You have some specific recommendations out of the Department of Health. So what are they?
Get the vaccine and get boosted.
Yeah.
So in all seriousness, we have 3 vaccines that are safe and effective for all Pennsylvanians who are 5 and older. Right now, over 76% of Pennsylvanians 18 and older are fully vaccinated, which is great news. We have seen the rate of vaccination slowing slightly, particularly in our boosters that folks need to be protected against the Omicron variant, as well as in kiddos, those under 18, 5 to 18. And so despite that, though, there's thousands of Pennsylvanians every day who are still getting vaccinated. Last week, we did over 108,000 vaccinations. Some of those are going to be your boosters. Some of those are going to be in kids. But overall, our strong recommendation is that people get vaccinated and get boosted.
Yeah, well, yeah. Do you think the fact that, and we're going to get to a COVID-19 update, but do you think the fact that it's in decline is the major reason why people are not doing what? Are not getting the booster shot? You think that has something to do with it?
Well, I think folks maybe aren't sure if they need to get a booster. As you recall, last fall, there was a staged rollout at first of who was eligible for a booster shot, which is why we're trying to get the message out that anybody who's been fully vaccinated should talk to their doctor and get their booster. Yeah,
that doesn't surprise me because there is some resistance to it, not based on, some might have to do with religious beliefs, some might have to do with the fact that they could get a reaction, a pre-existing condition, could prevent people from getting it.
There are certainly some reasons, but the majority of Pennsylvanians are eligible for vaccination and a booster shot, and we strongly encourage them to do so, especially those who have underlying health conditions. I'm pregnant right now, and so I'm considered immunocompromised. I was fully vaccinated before I got pregnant, and I got boosted while I was pregnant. And so it's important that folks who are in that immunocompromised category in particular get the vaccine and get the booster.
Yeah, well, before I let you go, let's talk about a COVID update. And you have, I think it's a weekly COVID-19 update on the number of cases. So why don't you give us a brief summary of that?
Sure. So last week we had just shy of 3,700 cases a day as our 7-day moving average, which is certainly a dramatic decrease in case counts since a month ago when we were seeing cases closer to 33,000 cases a day, which is just an extraordinary level of disease transmission. Similarly, we're seeing hospitalizations decline. We are fortunate that we have a very productive working relationship with the hospital and health system community. And so we have been able to deploy significant resources to help them when the rates of hospitalizations were higher, close to almost 8,000 people hospitalized with COVID. But now I'm happy to share that that rate of hospitalization is actually below 3,000, which is fantastic. And we're seeing deaths start to come down as well. We've got an average of right around 90 deaths a day, which is still too high in our opinion. Deaths are almost entirely preventable for individuals who are fully vaccinated and up to date, meaning they've had a booster. But overall, the cases, hospitalizations, and deaths are on a downward trend, and we're happy to see that.
Yeah, and you also provide simple tips, as you put in one of your press releases, and you have a federally funded marketing campaign to remind people. I think you say, vax, mask, test. I think that's the expression you used. How's that going?
That's the new slogan. You got it. Yeah, so we're going to be rolling out a new communications campaign to really emphasize to people that, yeah, we're moving in the right direction because Pennsylvanians are doing the right things, but we're not out of the woods yet. And I think as we learned with Omicron, we need folks to maintain a level of readiness, which is why vaccinating, masking if you're in a high risk situation, and testing if you don't feel good or you've been exposed, and then isolating if you are positive, are still our strong recommendations to Pennsylvanians.
Yeah. Well, there are a lot of experts that I follow who believe that A, will be another variant, and B, that this is going to be with us, I won't say indefinitely, but for some time. Do you have that same sense?
Well, I think what we've seen is that because there is such a high level of transmission, that's how variants occur. And so I think it's very likely that we will see additional variants crop up. And that's why we need to maintain that level of readiness to ensure that we're protecting our most vulnerable Pennsylvanians. I don't think that we know enough yet to say exactly how long COVID will be with us, but I think there's going to be a level of disease transmission that's occurring, in the foreseeable future, and that's why vaccination and boosters are so important.
All right, well, now I have an assignment for you. When you have some breaking news, please call and come back on the program because these are very important subjects, and I want to thank you for coming on. All right, coming up, guess what? We have public higher education is in the news, and we'll get to that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Welcome back. Well, joining me is Dr. Christopher Hallen. He's a vice president with APSCUF. First of all, the 14 publicly owned universities, not all of them, but many of them are in small town and rural Pennsylvania. That has to have enormous significance for the state of Pennsylvania.
Definitely. I mean, the step ahead is always higher education, and we're out there right where these people live, giving them a chance to improve themselves, to go further in. To get better jobs. I look at my students, and she was a janitor at a nursing home, and she wanted to help people, and so we were able to, in 4 years, give her a degree in nursing, and she's now a nurse at that nursing home.
Yeah.
So it's the wonderful thing that we can improve them and give them this chance. It's
an opportunity, given where they live, and given their backgrounds, that they probably wouldn't have otherwise if these universities. Now, I have to say something. I was a faculty member for more years than I'm going to admit at Millersville University, so I just want to point that out. Go ahead.
Yeah, I've been a faculty member at Bloomsburg for more years than I really want to admit.
But I need to point that out. All right, well, look, the governor this year, I don't know if he surprised everyone, but certainly the budget was really oriented towards education and a very substantial increase into the state system, into the 14 publicly owned universities, something like 15%.
Yeah, right now we're still suffering from the Tom Corbett years where he slashed the budget. And although it's grown back slightly over time with inflation, it's really been eaten away. And what we want as the faculty union is an affordable and accessible education for the students. And I think the governor, with his budget, has made a great stride forward. And we just have to now convince the legislators that this is a good plan, that it's an investment in Pennsylvania.
Yeah. Well, you know, there are a number of reasons why it's important. Have programs been curtailed over the last couple of years? I know that there's been some student decline.
Well, we've seen student decline. I think probably the COVID is one problem. Certainly the fact that the education is becoming more and more expensive. I mean, back in your day, we were, I think, a state-funded organization.
Right.
Now, I think we should say we're student-funded because the students pay the lion's share. They pay 3/4 of the bill. And this budget should, I hope, make it more affordable for the students.
Yeah. And when you look at other public universities around the country, the 14 publicly owned universities in this state are pretty much down near the bottom, correct?
Oh, we're 47th through 49th on ranking for funding for higher ed, depending upon what metric you're looking at. So yes, we're definitely, the students are funding higher ed in this state.
All right. Look, we're going to run to a break and we'll be back. I want to talk about what is being done to help. Obviously, you support the governor's proposal. That's not even in question. So let's find out what you all are doing to try to help the governor get it through the legislature. And we'll take that subject up after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
All right, well, let's talk a little bit about, as you said, Pennsylvania ranks at or near the bottom of the 50 states. And in the hearing, you know, the day after the budget proposal was released by Governor Wolf, the chancellor talked about what the proposed level of funding would allow.
Yeah, I think it's, they finally asked for enough money that we should be able to hold tuition flat right where we are now. Trouble we have is the inflationary costs that all of us deal with in our regular lives hit the universities as well. And we have the same issues of trying to get supplies in. And so if we can get money from the state, we don't have to essentially tax the students some more. We can hold their tuition down.
Yeah, that's an important point. And the fact of the matter is that when you take a look at our ratings among the 50 states and the fact that a lot of these young folks come from families that are, you know, living marginally anyway to how to afford it. Many of them can't travel to go to a school even if they could afford it.
That's very true, especially when you get out into the rural areas. I mean, we have a lot of lower and middle class students. That is our target, and what we have been doing was being priced out of the market. And these poor kids were, I mean, if they're spending all of their money to try to live, you don't have a lot of excess cash to spend on tuition. Yeah. And you especially don't have the excess cash to live on a campus miles and miles away. And so we're right there for them. We're present in their communities.
Right. You provided a very interesting statistic here, and I'll read it. For low and middle income families, income less than $110,000, and I presume that would be virtually the large majority of the students, almost 40 cents of every dollar earned goes to paying for a state system education, compared to just 20 cents of every dollar for high income families. I mean, that is one remarkable set of numbers.
It is, and I think it shows you the problem we have right now in the state of with being near the bottom of funding. We're not getting the money from the legislature. We've switched from a state-funded to a student-funded system. And it's hardship on the families. At 40 cents on every dollar, I mean, that's incredible.
And this isn't a case where, you know, we have this big debate about whether people just walk off jobs, don't want to work, and therefore it's a kind of, quote, welfare, end quote. That's not the case here at all.
Now, we have students that they want to work. They want to improve themselves, and we're giving them that opportunity. And I'm very happy to be one of the faculty helping them along.
All right, well, let's go to another subject. Well, what are you doing? I mean, you know, the governor made the proposal. Some lawmakers were not very pleased, to put it bluntly, with it. Others fully supported. And the state budget requires no new taxes, no income, no sales tax. In fact, he calls for a raise in the minimum wage, and he also proposes to cut corporate income, you know, corporate taxes. So there's a little something in that budget for everybody. So overall, are you optimistic or pessimistic about it, and then what are you doing about it?
Well, APSCUF has a long history of advocacy towards making higher ed in Pennsylvania more affordable and accessible for the students. And so we will continue our lobbying efforts on the Hill. We'll advocate for this budget. We will continue to point out, Dr. Martin, when she was here last time, pointed out it's
Current
an investment.
President of APSCUF.
Yes.
Go ahead.
My boss. It's an investment. For every dollar the system gets from the state, we put $10 back into the economy because the students are here, the faculty are here, we're spending the money here. And we need to look at this as an investment. Plus, if you can take someone from one strata economically and move them up, they're going to put more money into the economy.
Good point.
And we try to do it without massive student debt that is going to hold them back from buying that house, buying that new refrigerator, buying the new car.
What's the Nellie Bly Scholarship? You say it's back for a third year. Well, what is it?
Well, Nellie Bly is a proposal by the governor for scholarships in parts of the state economy like healthcare, education, sciences, to try to improve the economy of the state by getting our students into those fields. And so it's there to help our students get the affordable education by having these scholarships available for them.
Mm-hmm. And I take it the governor's proposal, this is not new, he's back being supported. Is that part, and that's part of the budget?
That is part of the budget, and it's something that we support because it will, again, make it more affordable for these students to get to their aspiration, get to a higher degree, get that job. Yeah.
Well, we're out of time, and I want to thank you for coming in and providing this update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.